flexing the right shoulder up. Okay, so with the extension maneuvers we did under Kaltenborn, we used a roll. With the flexion ones, we want to use the table to flex the table up. Now you don't have to, but the best way to isolate this to get the correct mechanics, you want to flex the table. So remember, in the lumbar spine, if you're doing flexion and rotation occur in the same direction. So, or side bending and rotation occur in the same direction. Sorry. So if we're doing right rotation, we need to right side bend the patient. So we're going to have to bring their shoulder and hips on the right closer together. The best way to do that is with the table. So when you're impractical and having a brain fart and forget, when you want to flex the patient, flex the table. When you want to extend them, roll with it. Okay? So right, scoot down a little bit. That helped 4 people last year. Okay, so, all right, so you want to get the table gap in the lumbar spine, and preferably where you're going to create the side bending, so you're going to get kind of a fulcrum there. Don't have to again. You can actually gauge the side bending as you bring the table up. You can do that with 2 hands. So I can palpate either on the ceiling side for the concavity to come together to pinch my finger, or on the table side to gap it. So I'm going to pick ceiling side, and I'm going to create a little side bending up to that level. Okay, so about right there. Relax. She doesn't like the side bend very well, does she? Is that uncomfortable? Okay. Right, so we're getting a little side bending there. Flex the legs up. And again, you can flex up to the level that you want. Side bend down. And then in this case, we essentially are trying to do rotation initiated cranially, which means we don't want to rotate caudally. So you're going to block with your bottom hand below. And just like the other techniques that we did with the rotation, you're going to be on the table side of the caudal joint and the ceiling side of the cranial joint. Okay? So, 3, 4. And then I'm just going to go into a little rotation. Now I'm blocking below, and you can have your hand across the side of the bottom there.
Can she move her arm?
What's that?
Can she move her arm? Oh, where do you want? I guess we can't see.
Oh,
Above your head or something.
okay.
Yeah, there you go.
All right, so we'll do like, is that better?
Yeah.
Okay. All right. And then rotate to get that stretch. And feel it right there.
Mm-hmm.
Okay. That's it. So a lot like the extension maneuver, except you're using the table to create side bending and rotation.